Prolonged cough and signs of chronic obstructive pulmonary disease according to World Health Organization WHO standards. Hello friends, if you are experiencing persistent coughing, coughing with phlegm in the morning, or feeling chest tightness after each cough, absolutely do not be subjective, because those are the most typical manifestations of chronic obstructive pulmonary disease. In this video, we will analyze deeply related to lung disease. Especially, the end of the video will provide vital notes on how to distinguish between ordinary irritation cough and cough due to lung parenchyma damage, along with the golden time for medical intervention to avoid respiratory failure complications. This is the most important information you should not ignore to protect your life. Before going into detailed content, please register and turn on notifications for MMM channel with YouTube handle at MMM. YouTube want to accompany us. And now we begin the main content. One is, we need to look straight at the harsh truth about the link between chronic cough and global mortality rates according to official reports. The World Health Organization affirms that chronic obstructive pulmonary disease is the third leading cause of death in the world, only after ischemic heart disease and stroke. In the year 2019, this disease took the lives of 3,230,000 people, accounting for 5% of total global deaths. In the United States, data from the Centers for Disease Control and Prevention shows that every 4 minutes one person passes away due to this respiratory-related disease. Prolonged cough symptoms are the earliest warning bell, but up to nearly 50% of patients in the U.S. do not know they have the disease until lung function has severely declined. Coughing is not just a reaction of the body, but is living evidence showing that the bronchial mucosa is being inflamed and restructured, leading to permanent airway narrowing that cannot be completely recovered. 2 is, the characteristics of a cough accompanied by phlegm are an important medical evidence regulated in international diagnostic standards. The World Health Organization defines chronic bronchitis, a component of obstructive lung disease based on symptoms of coughing up phlegm, occurring most days of the week, lasting at least 3 months in a year, and maintained for 2 consecutive years. In the United States, epidemiological studies have proven that people with symptoms of chronic productive cough have a risk of hospitalization for exacerbations 2.4 times higher than those without these symptoms. The color and consistency of phlegm after each cough also provide accurate information about the level of inflammation. Yellow or green phlegm is a sign of bacterial invasion, increasing the speed of lung parenchyma destruction. Ignoring morning productive coughs is the most common mistake, causing patients to lose the opportunity for treatment in the golden stage, leading to an average medical cost burden of up to $6,000 for each acute exacerbation at United States hospitals. 3 is, the data on the burden of cough related to smoking habits and environmental pollution are undeniable evidence. The United States Surgeon General's report affirms that cigarette smoking causes more than 80% of deaths from chronic obstructive pulmonary disease, and cough symptoms are a direct result of thousands of toxic chemicals destroying the cilious system in the airways. The World Health Organization also emphasizes that in developing countries, inhaling smoke from cooking fuels such as firewood, charcoal causes a disease burden equivalent to tobacco, especially in women. When fine dust particles with a size of 2.5 micrometers penetrate deep into the alveoli, they stimulate cough receptors and create systemic inflammation. Medical data from the U.S. shows that even passive smokers have a rate of prolonged cough occurrence 30% higher than people living in a clean environment, proving that the destruction of toxic smoke to lung epithelial cells is extremely terrible. 4 is, The decline in respiratory function measurable through medical devices is the most authentic evidence accompanying cough symptoms. When a patient coughs continuously, doctors in the United States often use spirometry to measure peak flow and lung vital capacity. Results show that in people with chronic obstructive pulmonary disease, the forced expiratory volume in the first-second index usually decreases to below 80% compared to the expected level. The World Health Organization notes that each violent cough can cause extreme intrathoracic pressure, causing the air sacs, which are already dilated and weak, to easily rupture, worsening emphysema. This creates a pathological spiral where more coughing leads to more lung damage, and more lung damage leads to more frequent coughs. Practical figures indicate that after each prolonged acute cough episode, patients can permanently lose from 10 to 20% of lung capacity, which can never be recovered by common treatment methods. 5 is the important notes on how to distinguish between cough due to lung disease and cough due to other causes are content that you absolutely must not ignore at the end of this video. According to guidelines from the American Lung Association, cough in obstructive lung disease is usually worse in the morning, accompanied by wheezing sounds and shortness of breath, even when performing light movements like making the bed or cooking. Conversely, cough due to gastroesophageal reflux often appears after eating or when lying down, while cough due to allergies often accompanies sneezing and runny nose. The World Health Organization warns that if a cough lasts over 8 weeks without signs of relief, accompanied by unexplained weight loss or coughing up blood, it is a red flag sign of dangerous complications including lung cancer or tuberculosis. Correctly identifying the nature of the cough helps patients avoid using medicine incorrectly, while ensuring that medical interventions are performed at the right time to protect lives and maintain human labor capacity. 6 is cough control measures. Lung disease prevention by vaccination and lifestyle changes according to international standards. The World Health Organization recommends that annual flu vaccines and pneumococcal vaccines can reduce up to 50% the risk of hospitalization for acute exacerbations in patients with chronic cough symptoms. In the United States, pulmonary rehabilitation programs, including correct breathing exercises, have helped reduce the frequency of miserable coughs by 35% and improved the quality of life for millions of people. Maintaining a living environment clean of tobacco smoke and dust is not just empty advice but is a vital strategy, because data from the Centers for Disease Control and Prevention shows that lung function starts to show signs of improvement only after 2 weeks of quitting smoking. Correct understanding of coughs and decisive action based on official medical guidelines is the only way for us to win the burden of disease and protect the precious breath for ourselves and the community. In summary, persistent coughs, morning phlegm conditions, or shortness of breath when exerting yourself are never normal, but they are the SOS signals from the damaged respiratory system. Through deeply analyzing scientific evidence about cough symptoms and the reality of disease in countries like the United States, we see clearly that proactivity in early identification is the most important foundation to protect lives. Do not wait until breathing becomes difficult to start acting, because delay can lead to permanent damage that cannot be saved. If you find this in-depth and honest content useful for public health, please register and turn on notifications for MMM channel with English handle at MMM. On these 2 channels, we will continue to share in-depth content about protecting lungs, liver, kidneys, cardiovascular, and common non-communicable diseases. Health does not come from luck, but is the result of correct understanding and choices made at the right time, in the right way. Thank you for following the entire content of this video.